Okay, so when you're ready, I'm ready.
Yes, go ahead. We have already 11 point.
Okay, good evening, everyone. Marhaba, I'm Abderrazak Ben Hamida from iCompass, Tunisia. I have graduated from Reading University in the UK with a master's in applied linguistics, and from the Chair Academy in the US with a degree in leadership training, with close to 40 years teaching experience and in education, in addition to program development and so on. I am now working as a linguistics consultant with iCompass Tunisia, and I'm going to talk to you about our chatbot, Aziza, to the rescue of Tunisian vulnerable groups during the pandemic. Well, Tunisia, the Tunisian population is among the most active on social media. They're very, very highly connected, and out of a population of 11 to 12 million, we have over 7 million Tunisians connected and use social media on a daily basis. And the population of smartphones actually outnumbers people. So we have, for every 100,000 people in 2019, we have 126.3 subscriptions. Therefore, as you can see, we have a very large digital linguistic community emerging. And our motto is from lips to fingertips. This transformation, of course, has an impact on communication in the country. So people now use their fingertips to speak, so to speak, on the internet, and using their experience from chatting and the various media they have, smartphones and so on, to communicate on a daily basis, mainly using spoken Tunisian, the Tunisian dialect. As you know, Tunisia, like the other Arab countries, has the phenomenon of diglossia, the existence of a standard variety and a spoken one. So official communication in the country by the government and educational institutions and so on is most of the time done in standard Arabic, sometimes in French. People use also English. There are quite a few students and other people who communicate in English, but the majority on social media, they use the Tunisian dialect. And therefore, it is necessary to take this into consideration when designing programs, particularly to inform the population like these days during the pandemic. Just to give you an example of the differences, when we talk about adwa, for example, adwa ufuqiyya, contamination or the transmission of the virus, in French we say transmission horizontale, in English it's horizontal transmission. The Tunisians, they say things like adwa ma ta'rafsh mnin, which in English means contamination, God only knows where from. So you can see the same applies to gel hydroalcoholic gel, or mutahhar kuhuli bil fusha. And in the spoken Tunisian, we have the adopted or the loan word gel, like in English or in French. So this large new digital speech community that has emerged, of course, comprises illiterate people. I'm afraid this is due to the school dropout phenomenon in the last few years. So we have about 280 pupils leaving school on a daily basis. That's 100,000 per year. And for the last 5 years, since 2015, we have about 500,000 school leavers, mostly males, between the ages of 13 and 17. And from 1980 to 2018, we have 4 million. So that's huge. Therefore, the illiteracy rate has increased, and it averages about 19.1% of the Tunisian population. This has been compounded by the Libyan crisis with the influx of 10% of our Libyan neighbors. And this 10% includes also quite a lot of people who are illiterate or people in need. So this, of course, has implications for communication in general during the pandemic. So we have labeled these groups the vulnerable groups. During the pandemic, it is essential for the government and the various authorities to reach the majority of the population to combat the virus. So these include illiterate citizens, rural women in various regions of the country, and people needing social inclusion and resilience. It is necessary, therefore, to find solutions to make information, especially official information, relevant to COVID-19, reliable information easily accessible to the vast majority. Of course, to avoid disinformation, fake news, and so on. Because the COVID-19 crisis, of course, has had a serious impact on communication among the population, with people spreading rumors, people not knowing what to do, etc. Therefore, back to the iCompass motto, from lips to fingertips, our teams have, of course, used the artificial intelligence know-how and linguistics expertise in addition to the innovative work of iCompass with local dialects, we have used this to help the Ministry of Health. Since the first case of contamination in March 2nd, and a couple of weeks later, March 16, following the lockdown, of course, helplines, green numbers, etc., were created to assist people answer their questions, but that was not enough. It cannot satisfy citizens' requests during such a crisis. The Ministry of Health, therefore, called upon iCompass to help deploy a chatbot that was on March 19th to better inform the population. And within a record time, literally 3 days, our team, of course, developed Aziza, which means it's a female name. Aziza means the dear one. It also refers to Aziza Othmana, a famous lady in the history of Tunisia who donated a lot to hospital and so on. And it also means the citizens' health is dear to us, dear to the government, and so on. So Aziza then was deployed March 22nd, and the lockdown, of course, the end of the lockdown was towards the end of May, May 24th. So Aziza then was born, and it is an artificial intelligence-based conversational service. It is multilingual, responding to citizens' questions in French, in Arabic, and in particular in the local dialect. And of course, iCompass used their innovative work with dialects to make it possible for citizens to ask questions in the local dialect, to local Tunisian Arabic dialect, of course, using the Romanized alphabet, Arabizi in the Middle East, and we now also have our version, Tunisian variety, Tunisi. The chatbot, of course, answers all kinds of COVID-19 questions, and it has been updated on a daily basis with new statistics and government decisions. It has been supporting the official communication to help eliminate fake news. It even tolerates chit-chat. This Aziza, like greetings, jokes, stories, advice, and even some psychological support for people. On the screen, you can see a sample, a screenshot there to show you how it functions and how interaction between citizens and Aziza takes place in the various languages and the local dialect. Now, some statistics here about the use of the chatbot. Between March and June of this year, people asked about 300,000 questions, and there was a peak of about 10,000 questions a day. And the response accuracy rate was quite high, actually. 95% of the time, Aziza responded accurately to people's questions. And you have graphs there in front of you. You can look at. Now, not only did we do that, but our teams continued working on fine-tuning our work with dialects and also extending it to African dialects. We are very much interested in the MENA region and Africa when it comes to dialects. And Amina, the bot, of course, was created with Nigeria to also help, with the COVID-19 related questions. And it responds in English, in addition to 3 other Nigerian dialects like Hausa, Yoruba, and Igbo. Now, the future is now, actually. Our team is now concentrated on further developing our services. And now we're working on a voice bot, actually, to make it possible to convert speech to text and text to speech to respond to questions from people, audio questions in addition to text messages. So we're working on that, and hopefully it will be made public soon. During the pandemic, our team also collaborated with other institutions to help combat the pandemic. For example, we contributed to the development of 2 robots, Yasmin, which has been used by a hospital in the city of Sousse, and it has helped with the screening of patients, of COVID-19 patients as they arrive. Also, the male equivalent, Aziz, which is a male name, the dear one, also has been used by some administrations to function as a as a receptionist to respond to people's or customers' questions initially before going to the specialized departments. So, as you have heard, this important a new speech community, digital speech community in Tunisia, which represents at least 2/3 of the population, heavily engaged in social media, particularly during the pandemic. It has been used by iCompass to, of course, find solutions to assist with the pandemic, and also use our know-how in terms of the work with dialects and artificial intelligence to use the data available, particularly in spoken Tunisian Arabic, which is converted in writing using the Romanized alphabet and from Arabizi to the now Tunisi. So this has been used to provide an important support for the government and for the population. I hope we will have a few minutes for further discussion or to answer questions. For more details about our work, please feel free to visit our website on the screen or contact our team. Thank you very much.
Thank you.
بالتونسي يعيشك. Merci. شكرا وتكرم عينك.
شكرا.